Welcome back. We know you have questions as the number of cases of the coronavirus climb in the U.S. We asked you to submit those questions on our website because we want to find out the answers to as many as we can.
Joining us live in the studio today is Dr. Christie Alexander with the FSU College of Medicine. Christie, thank you for being here. We're going to try to get through as many of these as possible. So our first question from our viewer is a person who has this virus but isn't showing any symptoms still able to transmit it to other people?
Yes, thank you for having me. First and foremost, I have to say that there is a lot that we still don't know about this virus. It's very, very important that we are checking in with the CDC's website on a regular basis. They're going to have up-to-the-minute information about what's going on. That said, to answer that question, yes, the simple answer is yes. You can be completely asymptomatic and be transmitting the virus. Like other viruses, it can take a couple of days to start developing symptoms, like the flu, for example. So as you're starting to get sick, you may not feel so bad, but could be shedding the virus.
Wow.
And you mentioned the flu, and as we're hearing about the coronavirus and some of these symptoms, they sound very familiar. So how are they able to differentiate between what could be the coronavirus or just the cold or a flu?
Very good question. So yes, they all look very similar, right? A cold, less severe. You might have some sniffles, cough. You might feel a little run down, but you're probably not going to have a high-grade fever. With the flu, though, you will have a fever. You're going to have body aches, night sweats, chills. You're going to not feel well. And so you're going to have these symptoms. And with coronavirus, the overlap is that with corona, you have fever, cough, and shortness of breath, difficulty breathing. So it's going to be hard to tell the difference sometimes, whether it's the flu, whether it's a cold, with the exception of that fever. And I should add that a fever is anything above 100.4 degrees. So below that, it's not going to constitute as such, which is important in regards to having a thermometer on hand so you can be checking these things if you feel sick.
Okay, some good advice there. Another viewer wants to know, can you get the virus by touching things like a doorknob, money handled by an infected person, or even mail or packages that have been shipped from China?
So the thing about this is it can be any surface, not just doorknobs, not just money, not just that, but pretty much any surface. If somebody sneezes or coughs and it lands, the respiratory droplets land on a surface, and you go behind them and accidentally touch that surface or grab the doorknob, things like that, you could have it on your hands. The big thing is not touching your face after that, washing your hands right after that. If you do touch your face, it's the mouth, nose, and eyes where it's transmitted the most. So keeping in check with that. But so any surface can do it. Now the good news is once the respiratory droplets dry, it's a pretty short-lived thing. It's not going to live on packages or money or things like that very long. But if it's recent and they cough and you go right behind them, you could pick it up your hands and transmit it to yourself.
Yeah, we've seen state officials actually talking about implementing some sort of, cleansing device at gas pumps so people can go ahead and wipe those off before they handle them.
Yes.
So washing the hands, you can't do that too much.
Can't.
What is the CDC recommending, or why are they recommending? Because we've been hearing that there's a shortage of the masks. Why are they recommending that the workers, go ahead and wear those protective masks, healthcare workers that is, but not the general public?
Great question. So we are in contact with very, very sick people, the sickest of the sick. And so we're using those really important N95 masks to prevent against those respiratory droplets getting into our systems. Those are things like tuberculosis. Those are the same masks we use for tuberculosis, for example. So we need to protect ourselves so that we can continue taking care of the sick people that we're seeing. The masks that you see around town that are just covering the face and go over the ears, those are best used for people who are currently ill. If you're sick and you're coughing or sneezing and things like that, those masks keep those respiratory droplets towards you instead of them being shot out into the public. But in the general public, if you're feeling well and wearing a mask like that, they're really not as protective as people think. So it's not protecting you if you're well from getting sick as much as it's protecting somebody who's sick from transmitting it and somebody who's taking care of the sick to wear the mightier masks to keep us from getting sick.
Okay, and this next question you've touched on, but I don't think we can go wrong spending more time on it. What are the best precautionary measures that the public can take?
So we talked about hand washing. The big thing with that is 20 seconds at least, and really washing your hands. Most people don't spend 20 seconds washing their hands. They're quick to wash, rinse, and go. So washing your hands for 20 seconds with soap and water, I might add, not just water, is key. If you don't have access because you're out and about or something like this, carrying around hand sanitizer, doing the same action as you're washing your hands with hand sanitizer that has at least 60% alcohol is the way to go for that. Beyond that, being careful to, when you touch things, to wipe down surfaces when you can. Now, you don't have to go crazy with this, but as you're wiping down surfaces, think about the most high-touch surfaces: phones, keyboards, doorknobs, counters, toilet handles, things that people are touching frequently. Those are the types of things to be wiping down. And if you are sick or you have a little cold and you need to cough or you need to sneeze, do that into a tissue and throw the tissue away. If you don't have access to a tissue, cough into your elbow or into your arm so that you're not transmitting the droplets. If you have to cough into your hand or sneeze into your hand, immediately wash your hands with soap and water, or with hand sanitizer. So those are some basic things you can do. And last but not least, if you are sick, stay home and call your doctor. Don't go out and hopefully not transmit it to others. Stay home, call your physician, see what they'd like you to do. They may not even want you to come in depending on how sick you are. If you don't have a physician, call the Leon County Health Department. They can direct you accordingly. And if you're not sure what to do beyond that, just call one of the ERs, call an urgent care center. Just call before you go is the main thing.
I'd like to get this question in just really quickly.
Yeah.
We're running out of time. But
Sure.
if someone does get the coronavirus, then recovers, can that person get reinfected?
We aren't sure. That's one of those unknowns at this point. We're not sure exactly. And so that's one of those things to be checking back to the CDC website on. Again, there are things changing up to the minute, information on that site. And it's really, really important just to keep in contact with the folks who know.
Okay, Dr. Alexander, we appreciate you coming in today and speaking with us. A lot of the information that you just shared will be on our website shortly at wctv.tv. Yeah, we'll be right back.